In Manchester, it would have taken longer because Devo Mank put a lot more funding altogether, didn't it? It was a very different kettle of fish to what we're looking at here in Wirral.
Devo Mank was across the whole of Greater Manchester. What I wasn't talking about the arrangements across Greater Manchester, but the Greater Manchester Health and Social Care Partnership, all 10 local authorities operated in very different ways. The decision of the Manchester City Council was to go down this route of pooling budgets and services with the CCG and the NHS trusts, but other places operated in different ways. So the overarching partnership was one thing, but the operation from individual authorities was separate within that.
Just that you referred to an elite trust and all sorts of things all being integrated, and that's not what we're talking about doing in Wirral.
No, absolutely it's not. It's the principle's still the same. It's about pooling budgets, but yes, it was just a smaller operation here rather than also including the trusts.
I'm just interested in you exploring it's the governance area again that I'm really worried about. You've elaborated that Manchester and Manchester City Council negotiated a veto into their contract. And I'm aware that we would still have a statutory duty to deliver adult social care. You know, it's a legal statutory duty to deliver adult social care, and also the safeguarding element to that. With what we've heard about the CCG being in deficit of 19 million and the apparent risks to Wirral Council regarding not having that veto to be able to come back and readdress and renegotiate and accountability, democratic accountability. In your professional opinion, Yvonne, what sort of risk would you say Wirral Council will be entered into regarding carrying out their statutory duties to social care?
I think that the biggest risk that I would be flagging up would be ensuring that there are adequate arrangements for the councillors to be assured that safeguarding practice is both adequate and sufficient, and that the quality of the safeguarding practice is there and that there is a system in place. In the contract there's only a very brief reference to safeguarding. You cannot devolve that through a Section 75. In terms of the statutory duties under the Care Act, the statutory duties are to assess need and then to meet that need. The risk in terms of being in partnership where there is a financial threat is that the potential would be that those services may not be able to be delivered, so people could have their needs assessed and then it may be financially impossible to deliver, to meet services to meet those needs, and that then exposes the council not only to potentially the local government ombudsman referral there, but also potentially to judicial review.
Thank you. I'm taking the last three now to Councillor Gardiner, Councillor Gilchrist and Councillor Burgess-Joyce, and then we'll move on to our next speaker. You can ask one more, Christina, and that really is it. Thank you.
Chair. Yvonne, we've heard a lot about full budget and the 19 million deficit. So could you just clarify, in your opinion, that whilst budgets are pulled, liabilities aren't pulled? So is the 19 million relevant to this debate?
For me, it would raise concerns of the potential for a CCG that's already in special measures to have its budgets capped by NHS England, and therefore its financial ability to meet the statutory requirements of the local authority would also then be at risk. That would be my concern.
Okay, thank you. Councillor Gilchrist.
I think I'm pursuing the same line of inquiry. So see it, the pool budgets are the pool budgets. The other headaches in the health service are separate. However, looking beyond the current year 2018-19, I have been reading the documentation about Healthy Wirral, which is more about the system and the system sustainability plan. So I would like us as a committee to explore both the answer to get now, but also to explore this question with officers of the CCG and Mr Hopkinson and other officers, so we can get to the bottom of that issue, see whether the pool budget is protected, is ring-fenced, is not going to be subject to some sort of dawn raid by other parts of the health service, so we're going to meet what the pool budget is for. Have we take a comment from beyond no and all that, and if that question is parked, and let other officers to answer when they get the opportunity.
I would think that it probably is, but if you can respond, please, Mrs. Rennie, that'd be useful.
So your question, Councillor Gilchrist, was that is the 19.6 million, is that protected? Is that your...
Is that a separate issue being addressed by other means outside of the issue of the pool budgets?
And I think my response to that is from what I have read, and I'm not an officer in Wirral, so I don't have the detail of that, but from what I have seen in the documents that I have read, my concern is that NHS England will step in and will cap the budgets of the CCG, and then whatever deficits they have, they will have to be able to make up in some way. My concern would be that the control of the pool budgets may not necessarily be ring-fenced.
Thank you, Councillor Gilchrist. And can I just ask one of the officers if you can to pick up that part of the question as well, please, so that we get a full answer. I'm going to take Councillor Burgess-Joyce and then Councillor Muspratt, and then we'll move on, please, to the next witnesses.
Good evening, Mrs. Nolan. You've obviously very tactfully and extremely well skirted around the political issues around some of this, and you've deliberately not put yourself in the position of being in Wirral. But you do have a very august career in the health service, so I'm going to ask you an opinion. The model that you've mentioned in Manchester, where there's sort of parity between voting, is it that the fact that you do have the ability to have an abstention from elected members or voting against, is it that causes the CCG not to put forward anything contentious, or is it because there's never anything been contentious brought forward? Do you understand where I'm coming from? Which way from an experienced officer's perspective would you say it was?
I think I remember having a conversation with our portfolio holder, and her comment was, if you have to operate a partnership on the basis of using a veto, then that's no partnership. It has very much in Manchester grown into a partnership. There was a history of working together in Manchester from where it began, so that helped. The power of veto is there, it's never been used. Hopefully it would never have to be used, and it always has been a process of negotiation at the board. However, I don't think you can ever underestimate how the knowledge of a power of veto oils the wheels of negotiation.
And last but certainly not least, Councillor Muspratt, please.
It's a question that's got, I think, two slides to it. You've mentioned consultation in various forms in your presentation. And first of all, consultation in terms of how all the partners were consulted. If you could tell us how that was carried on in Manchester. And also, was there any consultation with the wider public in Manchester? And if so, what way was that done and what form did that take?
Yes, there was consultation with all of the partners, GP Federation, all the trusts, Mental Health Trust, and so on. All the voluntary sector partners as well. The private sector partners, particularly for social care, many of the providers of social care, they were all part of those consultations. The workforce, I think we did something like 25 or 30 consultation events with the workforce across health and social care. And we did public consultation workshops, again about 20 across the city, where many hundreds of members of the public came along. There's also obviously the online consultations and all the documents and so on, but I think quite a few people benefited from being able to come along to actual workshops where they could ask questions and talk to officers. So the consultation process was extensive. It took in total around a year to complete all of the consultations.
Thank you. Can I just ask to follow up on that? Having looked at the document from Wirral, would you say that we have consulted, the consultation has been, well, it's obviously not as thorough as that. Is it adequate?
I couldn't comment whether it's adequate or not. I haven't seen anything in the documentation that I've read that lists the consultation meetings and workshops that have been held, so or the attendance at them, so it would be very difficult for me to comment as to whether or not that was adequate and sufficient.
Thank you. That would be a question to the officers then. Thank you.
Thank you, and thank you again, Mrs. Nolan. Okay, we're now going to move on to one of our decision taker witnesses, and I'm going to ask Mr. Graham Hodkinson to step forward, please. And Graham, just for the purpose of everybody in the room, if again you can explain your role and your role in this, please.
Good evening, everybody. I'm Graham Hodkinson. I'm the Director for Care and Health.
Graham, your mic is on, thank you.
Apologies, it was on and I switched it off. I'm Graham Hodkinson. I'm the Director for Care and Health in Wirral. This means I'm responsible and accountable for the quality and availability of care in this borough. I've been the statutory DAS advising this council on social care since 2012, when I came here to improve what was a failing social care department. During that period, our focus on integration has been a key platform for this council in terms of moving forward and trying to make sure that our services are properly joined up with the NHS. We have tried alignment, and we found that alignment alone didn't work, that we needed to change the system so that people within that system and staff working in that system were able to work in a much more joined up way. And that's why we've done what we've done in terms of joining services up. Just to be clear, there are 3 Section 75 arrangements. There's a Section 75 which is our arrangement in relation to integrated commissioning, which we're here to discuss this evening, and that looks at the pooled budgets. We've got a Section 75 in place which deals with the statutory delivery of health and care assessment, which is with CWP, the Partnership Trust. They operate all age disability services. That transfer was made earlier in the summer. And we also have a Section 75 in place with our Wirral Community Foundation Trust, where nurses and social workers work together in a single organisation and again carry out the health and care assessment and support planning. That's really important because we're only discussing one aspect of that this evening, and much of what's being said does not relate to that directly. Since 2014, the Council's had a statutory duty to integrate through the Care Act and a duty to promote greater integration with the NHS. It's not a choice, it's something the Council has to do. But why full integration? That's the question that's being asked. This is because alignment and partial integration simply doesn't work. Our approach puts the person at the centre of health and care rather than the organisations, and the Section 75 agreements that we have in place are simply there to enable this to happen. Have members had sufficient opportunity to consider the range and scope of integration and arrangements being put in place. Well, yes, proper process and decision making has been followed throughout. The Council's constitution enables Cabinet to be the key decision maker and Scrutiny to scrutinise those decisions. That's the process that we've followed throughout. Elected members have had significant opportunities to consider plans in detail as they've developed. Now, integration plans have been debated at Scrutiny several times and also formally signed off at Cabinet. The Council agreed to progress to a single commissioner in 2016, and that was launched in May 2018 this year. So, not quite as quick as I would have hoped, because it sounded like from what Don was saying that we were very quick at doing this, but actually it's taken a long time. So I think it's taken us a good 6 years to get where we are today. The Council's embedded the Joint Strategic Commissioning Board into its constitution as the key decision maker for health and care. The Council's constitution, for those that are interested, was revised this summer, and the Joint Strategic Commissioning Board features in there, as well as the responsibilities and duties of a key elected member. To be clear, Council lawyers were fully engaged in drawing up the Section 75 and in revising the Constitution. Cabinet were properly advised. Councillors have had the absolute say and still have the absolute say on social care decisions. This is a committee in common. The Council's Cabinet, 3 members, not the whole Cabinet, sitting alongside the CCG governing body board. There is no change in terms of their ability to veto any decision around social care. Again, that is a fallacy. The Section 75 has been in place for around 5 years, in particular the Better Care Fund. The value of the Better Care Fund in Wirral is £53 million. Of this, 15 million, to be specific, is for the protection of social care. We use that to fund 225 social care posts, and we also provide services with that for over 2,000 people every week through the year. And that helps them to get home from hospital, not to have to go into hospital, provide support in their own home. Some of those services are provided free at the point of delivery. Intermediate care, reablement, those sorts of services that are considered to be joint health and care services are free at the point of delivery. The issue here is that without a Section 75 in place, we cannot legally access the Better Care Fund. Without a Section 75 in place, we cannot operate those services in the way that we do. Without a Section 75 in place, those social care staff are at risk. Now, at the moment, we have a 2-year-old Section 75, which covers the BCF. It is out of date. We also have this new Section 75, which was intended to be in place for this financial year. So there is a question about how challenged we could be in terms of the legality of the current arrangements. This year, for 2018, the only addition to the Better Care Fund that's been in place for 5 years is care packages for people with learning disabilities. So all of the conversations about the CCG's deficit, the hospital deficit, etc. What happened there was that we did have the due diligence report. The due diligence report set out a number of risks that could potentially happen. We then, as a local authority and the CCG, considered those risks and advised Cabinet. Our advice was that we needed to ensure that the liabilities to the council were limited, so that we didn't want to get into the big NHS contracts.
Give me 30 seconds to wrap up,
okay.
Please.
And also, in terms of that limitation, that only care packages where it made absolute sense to pool resources were put in place. So a lot of the conversations about privatisation by the back door, none of the NHS contracts are in place. This is about care packages and people. Thank you.
Thank you, Greg. Can I have members' questions, please? I'll take Councillor Muspratt, Councillor Norbury. Okay, Councillor Norbury, Councillor Muspratt, Councillor Jones, Councillor Rennie.
On your presentation, Graham, you're talking about us not signing the Section 75 agreement, and this Scrutiny Committee is not saying that at all. We're saying we need more time to scrutinise because we didn't, well, I'm saying we didn't receive certain documentation, i.e. the Pricewaterhouse due diligence document. We have not had a chance to scrutinise that. We're also listening to advice from certain experts regarding other models of best practice, i.e. the Manchester model, which includes a veto. So just to make it clear, you know, we're presiding over information that we're getting, and we're not saying we're not recommending that it's not signed. We're saying we need more time to look at the implications of it being signed in the present circumstances. Can you explain to me why we weren't given the Price Waterhouse due diligence document till the 6th of October, even though we had requested that document on several occasions, all political parties, and we still haven't had a chance to fully scrutinise that document, which refers to an accountable care system?
Thank you, Tony. I think there were a couple of questions in there. So, firstly, this is a call-in, so my understanding was the decision was called in. So that means you called in the decision to sign Section 75, as I understand it. So if that isn't the decision, then... Are
you asking me a question?
No, I'm just responding to what you've just said. So that was interesting. So, you know, this is a call-in meeting, as I understand it, in relation to the decision that was made by the elected members. In terms of scrutiny, then clearly scrutiny can scrutinise any of those documents in as much detail as scrutiny wants to, and it's absolutely clear that scrutiny should be scrutinising that the arrangements that we've put in place are appropriate and that they deliver exactly what we've said they're going to do. That is absolutely the case, Tony, and there's no argument from me on that, absolutely the detail of all of those things. However, in advance of the decision being made, the PwC report, for example, was exempt, and the reason it was exempt was because there were a number of potential scenarios in that document. They talked about potential overspends in terms of social care, which never happened. They talked about the potential for overspends in the NHS, and they drew up a number of what-if scenarios. Now, I think it's fine to look at those what-if scenarios now in retrospect. However, looking at those what-if scenarios in advance of the decision to make the bill charged us with officers to respond to the report and to make recommendations to Cabinet in relation to the size of the pool and the scope of the pool. Members will recall that when we set about this process, we were talking about pooling the whole of the adult social care budget with the whole of the CCG budget. And what the report said was there are huge pressures around the hospital, and you need to recognise that that's going to be a big financial pressure. And they said that there are huge pressures around adult social care, and adult social care isn't properly funded. So from a health perspective, that's a big risk. So what we did is we worked out what we needed to put in the pool. So that's why we said we needed to pool the Better Care Fund services, which are primarily services which are contracted on block, so the risk to those is minimal. And then we also then decided that the key other area that was really important was services for people with complex disabilities, people with learning disabilities, and those care packages.
Point of order, Chair, can I just ask who he's referring to as we?
Councillor Norbury, can you just... Thank you.
We is the Council and the CCG. So these are the decisions that were made by Cabinet, that Cabinet signed off several months ago.
Okay, thank you. Can I take Councillor Muspratt now, please?
I've got a number of questions, Graham. I'm just going to ask you the first couple, and then if there's time, other people have that ask them. You've made reference to the fact that we have every right to scrutinise, and I thank you for allowing us to scrutinise. Unfortunately, you haven't given us the documentation that allows us to scrutinise, and you said yourself it had scenarios in it, so therefore it wasn't given to us. Well, I don't know whose decision that was, but a number of councillors from across the divide asked for that document and it wasn't given. And I do find it very difficult if you are asking us to scrutinise something when we're having half an argument. We are here to look at all the pieces of information. That's why we're elected, Graham. We're not here to be given what you feel we need. And that, my question is, why did you all feel that we weren't supposed to have that document? The second question is, on consultation. What consultation did take place? I wasn't on adult scrutiny at that time, so I don't know. I've only picked this up from when I came on, and as you know, I've asked questions about it every single meeting, because I don't understand where the scrutiny can be in something when we're not given any information. So, in terms of consultation, we've heard the Manchester model. How did we tie in with that? And the very last question on this bit, and it's a very quick one. Do alarm bells ring when you go in association with an organisation that's in deficit?
Thank you, yes. So if I start with consultation. If I start with consultation. There have been consultations in advance of the decision to move forward with the full integration of health and care, and they were put forward as part of the Council's transformation programme, but they took place within a budget setting process several years ago. Consultation was not required specifically in relation to putting together the Section 75 for the Integrated Commissioner, and that didn't happen, and it certainly didn't happen in the way that Manchester did. However, we had full and detailed consultation in relation to the services that deliver directly to people, and that's why I mentioned before that there are 3 Section 75s. So in the all-age disability service, we consulted with several hundred people that have those services, and 70% of those said that they wanted a joined-up health and care service, and we also recorded a whole range of their comments in relation to why that was important to them. We also consulted in relation to the older people's community social work services, again, services that deliver directly to people. So the answer is no, there wasn't consultation with people in that sense. You did ask me, in terms of the broader sense, what happened. The other issue was that in June 2017, I came to Scrutiny, I came to this committee, and talked about, and it was recorded at the time, it's available on the web, key features of the future health and care system, and we debated that and recorded the detail of the conversation. But in broad terms, what we said was the features of that future integrated health and care system was integration, centred around the individual and focused on outcomes, that budgets would be pooled and people resources, that there'd be a focus on prevention, co-production and personalisation, and that we would want a properly funded baseline, and that we would focus on localism, not centralism. And again, our strive towards neighbourhoods is helping us in terms of that localism agenda. So there was a very detailed debate here, and there have been lots of debates through Cabinet and other places within the Council. The next question then was in relation to the PwC report and why it wasn't published. At the time when the decision was being made by Cabinet, the response in terms of how the pooled fund would be fully constructed, what would be in and what would be out of the pooled fund hadn't been published. So the issue there was that the PwC document was exempt, so it wasn't in the public domain. The document has been made available into the public domain, so this specific decision included the PwC document in its full entirety. So the decision that's been called in today, it was published alongside the notes for the meeting, along with, and this is the important bit, along with the risks and the mitigations. So the clarity of what mitigations have been put in place is with that document, and that's what was important in terms of its publication. Now, I feel you're absolutely right. It is absolutely ready for that to be scrutinised, but that was not pre-decision, that was post-decision.
And the last question was, do you have any concerns about joining with an organisation that's just got financial problems?
So again, within the PwC reports, as I've just set out before, there were a number of risks that were identified. The deficits within the CCG were recognised as a particular problem, as were the Council's problems in terms of the Council's finances and the level of reductions that the Council's faced. I think it's very clear that both organisations have severe financial challenges. What we've done is we've ensured that the pooled fund focuses on the areas that are not the highest level of financial challenge, so that we've kept out big financial challenges from the CCG perspective, and we've kept out the older adults element of the social care budget, which again is the biggest financial challenge from a social care perspective. So what that means is we've mitigated against that potential risk, Christine.
Thank you, Greg. Now, we are going to be drastically running short of time if we're not careful. So the last questions I'm going to take is Councillor Jones, Councillor Rennie, Councillor Gilchrist, Carubia, Clements and Cottier, and that's it then.
Thanks, Chair. Thanks for your presentation. With regards to the 53 million Better Care Fund, I'm right in thinking that it's only if we are finding in Section 75 that that money is available. Is that correct?
That is correct.
Okay. So if we weren't to pull budgets, are we then unable to access the Better Care Fund? And if so, is there an alternative fund that we could access that would, meet the same revenue basically?
So the within the 2012 Act, it set out how this would happen, but in essence, the Better Care Fund has to have a Section 75 agreement with it. That was funding that was put in place primarily to protect social care. So of the 53 million, 15 million specifically is being used to protect social care where we would have had cuts. So we would have direct cuts of 15 million. There is no alternative funding on the table at this point in time for that.
Thanks, Chair. Yes, thanks to the Director of Social Care for dismissing quite rightly, I think, some of the myths around this.
Councillor Rennie, I think some people can't hear you. Can you just
Sorry,
bring your mic forward, please? Start again.
Sorry about that, Chair. I was just making a comment that I think some of the speech that Mr Hodgkinson's actually given us has actually dispelled some of the myths that seem to be flying around here tonight. Could I ask the Director, the inference really about this, I feel, is highly politically motivated. It talks about that this particular system would be the precursor to privatisation. Can you assure me, which you've gone some way to do, that that is not the case insofar as the pool budgets are concerned? My concern is we've been around this table, many of us, for a long time, and as you quite rightly say, when you came here in 2012, we were talking about pooling budgets then for the betterment of the people who actually needed it, those people that were in hospital, waiting to come home, and clearly the system was a complete and utter shambles. The present Chief Executive of this Council, when he came for his interview here, he spoke about the need for pooling our budgets, to have one integrated system where a person in hospital for requiring services literally, as it says in the report, told their story only once. I'm sure other members, the same as myself, have met many people. The ones I've met have been mostly older people who have been absolutely bereft of the service.
Pointed to order, Chair. Is there a question involved in it?
Well, I'll come to it when I'm ready, Chair, if that's all right.
Yeah, you can just move on.
Yeah. I don't want to hog it, but we are here for the betterment of those people who are in hospital, who are waiting to come home, and that the system is failing. And many of those people are older people, many of them are confused, many of them don't have people in their family, they don't have friends.
Can you just ask the question?
Yeah. Can the Director assure us then that what is here before us tonight within the documents here will actually help those older people, those people within the system, for want of a better word, not to require the beds which are being blocked within the hospital service, and to get those people home with care packages so they can live out what I hope is the remaining terms of their life in comfort and with adequate health and social care.
I can confirm with Scrutiny here that all of the services that are in this section 75 are services that are directly delivered to people, both people with complex learning disabilities and people that need support to get out of hospital and get back onto their feet. We are using this section 75 and the arrangements around it to build collaboration, and that's about NHS providers and care providers working together. It's not about privatisation, and it certainly isn't about contracting out services. When we transferred more than 200 staff out of the council, we transferred them into the NHS. We didn't put them out to tender. That was completely discounted immediately. We put them into the NHS. We used the section 75 to contract for that service. In fact, in both cases where we've put the social workers out, because that means we don't have to tender those services out, because we have a section 75 Health Act flexibility, which is a partnership agreement. So the reason that we use these tools as opposed to the alternative tools that we talked about before is because they enable us to offer protection, and they enable us to use partnership as the way forward, as opposed to compulsory competitive tendering. So it's the complete opposite of what people think it is.
Thank you very much. Councillor Gilchrist.
Several aspects. The first one, Mrs. Nolan gave us a detailed account of work that was done in Manchester over several years. That reminded me of the work that John Deverling did in the early stages to prepare Healthy Wirral. Is that a valid comparison?
Healthy Wirral is the key plan for the health and care system. It sits underneath the 2020 plan, which is Wirral's plan for the place of Wirral. And it's the key place where all of our planning comes together in terms of how we will support people and make best use of our resources in supporting those people. So there is a valid comparison there in that that is the plan for Wirral, and it is our core plan.
The paper before us is largely about 2018-19, with some looking ahead. What is the process whereby the cabinet members are talking to Wirral's directors about particular levels of service? How does that fit in with the council preparing its budget for 2019-20 and onwards?
So at this point in time, council is considering its budget as a whole, and within that budget is considering what the availability of resources are for social care. In terms of the medium-term financial plan, that makes some assumptions, and that is coming here for consideration, I understand. So the council then decides how much it's got available to put into the section 75. The conversations will be around how that fits with the availability of resources for social care within the council.
I'm going to ask, because time is moving on, Councillors Carubia, Clements and Cottier, are they completely different questions that you've got? Okay, I'll allow them, thank you.
Thank you, Chair. I'll be really quick. Hi, Irene. You mentioned, I was going to ask a question that's been asked a few times so far, and I'm still not, because I'm not the wiser on the answer. And that is about this 19 million deficit, which you did mention is not applicable in this discussion. And yet, on page 13 of the due diligence report, you mentioned it yourself, you picked it up as a major risk. It does say the management of historical deficits, particularly the CCG, and how this would impact the pool fund arrangements going forward. Now, it's been asked several times from a few different people, is that going to be ring-fenced? And what is the impact going to have on the funding and the pool funding? And I still haven't, maybe it's maybe in thick, but I still can't get my head around what the answer has been. So can you give us a definite answer?
So to be absolutely crystal clear,
Yeah.
the £19 million deficit that DWC were talking about was a deficit created through the costs of running Wirral University Teaching Hospital. When you read the report, you'll see that the key issues here are demand growth around old people accessing the hospital and the costs of that. So that's a key factor. That we decided to keep outside of the build fund so that the risk was not shared. So that is still a risk. It's a significant risk within the health system, but the health system alone, it is not part of the Section 75 arrangement and won't be in the future.
No, I don't need Councillor Carubia, I need to move on now, thank you. Councillor Clements, did you Okay, so Councillor Cottier, please. Thank you.
Thank you, Chair. It was along the lines of Chris's questioning. There's been talk of palliative esteem, the same on palliative accounts. The Wirral Council balanced the books, the CCG haven't, which is a big alarm to me. That's meant to tell us about. You mentioned about leaving ourselves open for legal challenges. Can you make it clear who the challenger would be?
So at this point in time, the services that we operate as joint services, so reablement services, intermediate care services, step up, step down services, they are currently delivered to people as a joint health and social care service. And what that means is we've said because they're joint health and social care services, they're delivered to those people free at the point of delivery. So there is potential challenge from anyone that suffers in those services, I guess, in terms of how the service has been offered to them if we don't have the appropriate arrangements around it. Now, as I say, there is a Better Care Fund from 2 years ago that offers us some cover, but it's not up to date, so it doesn't cover all of the detail of the current range of services. The other people are those people with learning disabilities that find themselves in long-stay hospitals or other inappropriate environments where we have not currently got a joint health and care package to support them. And the reason, again, we've pooled those resources is so that we don't have to have the fight between health and care about who funds the service to move those people out into the community. So there is potential in that particular instance of challenge from NHS England in relation to the length of stay of people in hospital. But more importantly, the issue there is about people being in hospital for long stay inappropriately, and the key issue there is those people.
So who would be the...
Well, in any of those cases, a legal advisor on behalf of an individual would be able to challenge us in terms of the appropriate legal cover for the services they've been provided with.
Thank you. No, I can't tell you to move on now. Okay, thank you, Graham. And I'm now going to ask Dr. Sue Wells, our second decision taker, witness, please. And again, Dr. Wells, if you can just talk us through, can we just have 1 minute, please? If you can just talk us through a little bit of background history here, thank you.
Good evening. Thank you very much for allowing me this opportunity. So, I'm Sue Wells. Some of you know me as the Chair of NHS Wirral CCG, but probably for what I want to talk to you about now, my more important role is that I've been a Wirral GP for over 30 years and still am. So as a GP, when a patient comes to me, with whatever the issue is, I need to think about it in terms of physical, psychological and social issues, because they are all absolutely interrelated. So every GP on Wirral on a daily basis will see people who have both health and social needs. Well, that's because they're elderly, frail, disabled, or many other situations. And their social and health conditions have such a profound effect on each other. Now, I'm as passionate as anyone else in this room about the NHS. It's my whole career. I should be an NHS patient for my whole life, as many of us will. But the health service simply cannot manage care needs on its own. We need to work with social care so that we can give the best care we can for the individuals. We know that social determinants of health have a greater effect on the outcome of health than actual health care itself. So it seems clear to me we need to deal with whole people,